So this is actually going to be a dialogue, but since I'm at the podium, I'll start here and then sit down for a dialogue with Annette Dixon. So for those of you that don't know me, guests are visiting, I'm Joanne Carter. I'm the Executive Director of Results and Results Educational Fund in the U.S. Thanks, that's always fun. But I'm really thrilled to have this opportunity for this dialogue with World Bank Vice President for Human Development, Annette Dixon, to get a chance to discuss the critical need for increased and more effective investment in human capital, areas like health and nutrition, education, social protection, in order to achieve the goal of ending extreme poverty and ending poverty by 2030. As folks know, the World Bank is a major and influential investor in these areas, and we're going to explore both the bigger role the bank's own resources can play in this area, and also how the bank is working in many new ways to encourage increased domestic investment, including through a new human capital index. We're really thrilled today to have Annette Dixon with us. Annette is the Vice President for Human Development at the World Bank Group, and in that role, she oversees the global practices for education, health, nutrition, population, and social protection and jobs. She was previously the World Bank Vice President for the South Asia region, and she led relations with 8 countries, including India, the institution's biggest client. She actually joined the bank back in 1999. She was a sector manager in human development in the Europe and Central Asia region, and I think we'll come back to this a little bit later in her very early and important work on tuberculosis in that region. From 2008 to 2013, she held the position of the country director for Southeast Asia, and she is a citizen of New Zealand, and before joining the World Bank, Annette Dixon worked for the government of New Zealand as chief executive of the Ministry of Youth Affairs. She also served as Deputy Director General in the Ministry of Health, also as Director of Health Policy Department for the Prime Minister, and Manager of Policy Division of the Ministry of Women's Affairs. So a very broad background in these and real lifelong commitment to these interests. So please join me in welcoming Annette Dixon to this session. And then I think before we start our dialogue, I did want to say that originally World Bank President Dr. Jim Kim was going to be joining us today. His meeting with the President of China was rescheduled from last week to this week, so that was a pretty good reason to be in China. But he did apparently send just this morning a short video, which a few folks have seen. I haven't seen yet, but anyway, just a short video message to the conference. So I think we're going to run that, and then we'll jump into our dialogue if we're ready.
I haven't seen it either.
I haven't seen it either. I think it was actually taken on someone's iPhone in China, so. Do we have that queued up, or? Because we can also come back to it. Should we wait? Sorry, folks, do you want me to go ahead and, oh, there.
I'm so sorry I can't be there with you in person on an important trip. But I want you to know that going to the results conference is one of the highlights of every year. Next year, I promise to be there. I want to thank Secretary Joanne Carter and all the U.S. volunteers for their great help in supporting our HighLevel funding. I know that many of the volunteers from all over the world have been voicing their support for the World Bank Group and HighLevel. I want you to know that we deeply appreciate it, and your efforts have made a huge difference in getting us to where we are today. Our fund for the poorest countries is now 50% larger than it was 3 years ago, and it's going to make a huge difference on the issues that all of you care so much about, especially around the issues of health and education. You know, Annette Dixon, our new Vice President for Human Development, has been leading the efforts around our Human Capital Project. So many efforts that you have advocated for and that I've advocated for in my previous career have now been flowing for health and education. But one of the things we've noticed is that governments in some of the poorest countries are now waiting for those funds to flow. And we're not seeing the kind of commitment to improving health and education outcomes that we need to prepare countries to compete in the economy of the future. You know, we've looked at our learning-adjusted years of schooling and then added to it very straightforward indicators like childhood stunting, adult mortality, and life expectancy, and asked a pretty simple question. If you take learning-adjusted years of schooling and those 3 health indicators and look back 25 years and ask the question, are improvements in those indicators related to economic growth? What we found was really quite stunning, that the correlation of those factors to economic growth were among the strongest correlations we'd ever seen. It's not just that investing in health and education is a good thing to do. We found that it is in fact the smartest thing to do if you want your country to be able to compete in the global economy and if you want to create the kinds of jobs and opportunities that every citizen deserves. You know, I think that the launching of the Human Capital Index that will happen at the annual meetings in Bali in October is going to be very important for all of you at Results, and certainly for all of us at the World Bank Group. But it's also going to be really important for our effort to end poverty and boost shared prosperity. One of the things we've learned from the Human Capital Index is that focusing on real outcomes, on making sure you're learning in school, making sure children are not stunted, making sure that adults are not dying of diseases that are either preventable or treatable, and living long, healthy lives, all those things are going to be ever more important as we move into a future where automation, artificial intelligence, and robots are going to take over a lot of the simpler tasks. What I think will happen with the Human Capital Index is it will move heads of state and ministers of finance from waiting for the money to flow in grant form, preferably for health and education, to one in which they're going to demand that all of us work together to help them improve their outcomes. There's nothing like a ranking to capture people's attention, and my hope is that after that ranking, the volunteers of Results will be in greater demand. People will be asking all of you, so what can we do to improve our outcomes? I also think that the demand for lending from the World Bank Group and the expertise of the World Bank Group will also go up. I hope you have a great conference. I want you to know that your work has been extremely important for us in this year in which not only have we launched the largest IDA in history, but we've gotten a capital increase that will allow us to extend our reach and give every single person on earth the opportunity that he or she deserves. Thank you very much.
I think he said it all.
So, Annette, on this, maybe on this broader, President Kim did lay some of this out, but sort of on this broader human capital project and the direction the bank's been going in, and really you are sort of the leading edge in the role that you have, and then maybe a little, he described a bit about the Human Capital Index, but I think saying a little bit more about the role that you see we could play. So just the Human Capital Project and where the Human Capital Index sits in that, and how you see the advocates, not just from the US, but from all of the countries that you were just meeting with, can play a role in this.
Oh, great, and thanks very much for the opportunity to come. It's a real pleasure to be here. I've had a little bit of contact with partners from Results in my previous incarnations as both a country director and a regional vice president. And I think it's a great partnership, and our goals are very much aligned. Just to put it simply, the index is really something that we think will help to focus the policy discourse, if you like, the policy discussion in a country on whether the country is investing enough, and is it investing well enough to get the kinds of human development outcomes that all countries need in order to grow and improve the living standards and reduce poverty in their countries. And I think the unique thing about this index, because there are many human development indexes, including, of course, the UNDP's Human Development Index, which we all know, the unique thing about this index is that it is identifying those outcomes, as Dr. Kim said, that are closely correlated with economic growth and productivity, because we know that that drives poverty reduction so clearly. And the index is part of a broader effort where over the recent years we've really been trying to draw attention to policymakers about how important it is to invest in people as well as investing in other things in the built environment and so on. And the work includes last year's World Development Report on the learning crisis, a report that we released about 6 months ago called The Wealth of Nations, which actually measures for the first time, measures human capital alongside built or productive capital and natural capital. We've always measured built capital or productive capital, and we've in the last 2 decades or so been measuring natural capital. For the first time we've added human capital to it, and of course it shows what we all know is that it's the most important investments that a country can make. And the planet as a whole, about 2/3 of wealth is in the form of human capital, but it's much larger in developed countries. It's over 70% in developed countries and about 40% in developing countries, so it's really important. We've also done reports with the same methodology looking at women's wealth and how richer the planet would be if we invested in women, and if women were able to be as productive as men. We've looked at the cost of not educating girls, and we've looked at the cost of early marriage. So these reports really, I think, bring a very compelling story together and really try and create a sense of urgency around this agenda. So the index will be launched in Bali at our annual meetings, and I think it will really, for those of you that are involved in advocacy on these issues at the country level, I think it will really depend on the country situation. We've been really struck so far in our discussions with countries just how relevant this is for all countries, because we know that the nature of work is changing with technology, and countries need to be even better educated, if you like. Populations need to be even better educated. So the frontier is moving on all countries, but there's an urgency for developing countries around this agenda. We've asked about we actually wanted to have a few countries that would come to Bali with plans to accelerate progress. We thought we might see if we could get 10 countries. So far we have over 30 countries signing up. And they really span across a really important range of differences. There are, of course, very poor countries that actually need to make even foundational investments to ensure basic services are available to all their citizens. And they need they're so poor, they need a lot of ODA to help them do that, but they're still building their systems. There's a second group of countries, as Dr. Kim talked about, that we know are under-investing, but they could actually be investing more if they mobilized more domestic resources and made a priority. They could invest more in the development of their people. There's a third group of countries that are actually investing. They know it's important, but they're not getting good results. And they're, if you like, they're not performing as well as they could in terms of getting the outcomes. And there's some reasons why that might be. And then, of course, there's countries that are investing and getting good results, but they're still not happy with the progress because the frontier is moving and they want to do even more. So this actually is something that's relevant across developed and developing countries as a tool for focusing policymakers' minds on these issues.
Great. Maybe to dig into a few of the issues around this, many people in this room have worked on the issue of nutrition and undernutrition, and we're actually very encouraged that the Human Capital Index includes as one of its 3 main indicators stunting, so children being physically and mentally stunted from undernutrition and deprivation, and we know that's 1 in 4 kids in the world. Just would love to hear more about what was behind the decision on that in particular. As I said, I think we feel like it's really important, adds to the power of the index. But anything more you would say about that decision, and even maybe perhaps anything you're seeing from some of those 30 countries that are stepping forward to actually address stunting?
Oh, thanks. Yeah, I mean, I think we're all increasingly aware of the importance of the early years for a child's brain development, and we know that stunting actually inhibits the brain's development, and so hence is really important for ensuring that reducing stunting rates is really important for ensuring that all children reach their full potential. Now, I think in the bank, Dr. Kim has actually done a huge amount to raise awareness of these issues. When I was regional vice president in South Asia has many countries where stunting is a huge challenge. Every discussion he had, not just with leadership in countries, but with newspaper editors, civil society, he's been raising these issues. And as a consequence, countries like Pakistan have now actually started to really take these issues seriously. 2 weeks ago, he was in Indonesia visiting some of the programs that the government is financing, including piloting, scaling up community health workers to really focus on these issues. Now, I think we're all focused on the nutrition linked to stunting. I think increasingly we also know that some other issues are really important, one being air pollution. Pollution generally can actually inhibit young children's brain development, and so I think air pollution in many developing countries is extremely high and very dangerous. And we've started really doing a lot more work showing the health implications of pollution. And then the other is exposure to sustained violence is really important, and this is obviously relevant for children growing up in conflict, but also children whose families have a lot of violence, and so that's another really important dimension of it. I think the challenge around stunting, and even if you just focus on the nutrition aspects, is it really needs a whole of government focus to tackle it, because it's so multi-sectoral in its dimensions, and it's obviously worse in poverty situations, but it's not just in poverty situations. In working in South Asia, I've been really struck that even the highest income households still have children that are stunted. And we are working very hard to try and understand the complexity of the issue and to really understand the underlying causes. In some cases, it's obviously linked to sanitation challenges, which affect everybody. But there's also, if you have high levels of pollution, then that may be also contributing, and so on. So it's not just about food security in the poor. It's really a much, much more complex set of issues, and really needs, I think, a really sustained effort. And the other thing I would say, and this is where I think groups such as yours can really help, there's a lot of stigma associated with using the terminology around stunting, and some policymakers won't even use the word. And so I think sort of finding ways to have you can talk about nutrition. It's easy to talk about nutrition because everybody knows what that is, but it's actually quite hard for policymakers to confront the actual consequences for young children of being stunted, and to actually realize that what is happening as a consequence of policy failures, if you like, is actually affecting the long-term development potential of their population and their countries. So I think it's having the conversation in ways which actually gets policymakers aligned is really difficult, and something that needs, and obviously it's contextual in some countries related to culture and so on, but it's really important.
Yeah, no, really, really helpful and useful, and including the air pollution links, and thinking about how we think about many of those things in a multi-sectoral ways, and well as obviously sort of multiple health insults from kids, for kids that are then not getting health care as well, that kind of creates that downward spiral. President Kim mentioned also the historic IDA replenishment, the fact that we've seen almost a 50% increase in the total pool of resources available for low-income countries. And so I'd be really interested in just broadly how you see the Human Capital Project linked to this, how it's helping drive both supporting countries to prioritize human capital investments with their IDA resources, and just maybe after that also just saying a little bit about the Global Financing Facility. Some folks are very familiar with that, many are not, and sort of how that is one of the, in a way, the tool that the bank and partners are using to encourage more investment in some of those areas.
Yeah, I mean, I think what is happening in the bank is actually really important in terms of the financing available for developing countries. So most of you will know there's the IDA, which is the International Development Association, and it's the fund for the poorest countries. And it's replenished every 3 years, partly from profits from the rest of the World Bank Group. So profits from IBRD, which is the bank part of the bank, which is the non-concessional financing available for middle-income countries, and IFC, which is the private sector arm. And for years we've used the profits from those two institutions to fund the fund for the poorest countries. And then when we started to do debt relief, we decided we needed to actually have more countries receiving grants to avoid loading up poor countries with debt. So donors over the years started actually adding to the replenishment to top the fund up. And some of those replenishments reached record levels, but they've been plateauing and coming down. This last year, we did something really historic, which I actually think is really profoundly important. We agreed with the donors that they would maintain their replenishments at their existing levels, and we would change the way we manage this fund. So we used to fund it just like a trust fund. And we decided to try and actually have it operate like a bank, using the rating that we have for the rest of our institution. We have a AAA rating, so we make an enormous amount of our financing for countries from investing in the market because we have such a high rating. And we were able to get IDA rated with a AAA rating, which means we can invest and have significant returns coming back. Now that's a kind of, very techie thing, but what it actually means is that the ratings agencies believe that even the poorest countries in the world are a good credit risk because of the track record that we have. IDA is like a solidarity fund. Countries have been poor, have benefited from it, become donors and underpin it. So, we have countries that have graduated from IDA that are now donors. And even some countries that are still getting IDA money are actually donors to it. So it's like a big solidarity fund, if you see it that way. But it's amazing that the poorest countries in the world actually are now being regarded as a good credit risk. And that's in part because IDA is really the last, the financier the first in line to be repaid and the lender of last resort. That's the term I'm looking for. And that has enabled us to increase our financing to the poorest countries in the world by 50%. So we're probably the only development partner that is in the current environment actually substantially increasing our funding to the poorest countries. And as part of that exercise, we've agreed that we will finance the poorest of the poor even more than 50%. So they will get, so all developing countries that are IDA countries are getting more funding, and the poorest are getting even more. At the same time, the bank part of the bank needed a capital injection because since the global financial crisis, the lending needs for middle-income countries has actually been higher. And at our spring meetings just past this last April, the shareholders agreed to a capital increase for both IBRD and also for the private sector arm, IFC. Now, I actually think that was a pretty amazing achievement in the current environment where there's a lot of stress on multilateral institutions, that there was a complete consensus amongst our shareholders to do that. So actually, as a whole, we're actually able to increase to the poorest and to the lower middle income countries and for private sector investments. Now, actually in human development, we've been increasing our financing even more. In this past fiscal year that just ended at the end of June, the bank's financing for human development, which includes education, health, nutrition, population, social protection, increased by 74%. So, and that, I've only been in this job for 3 months, so I can't claim any credit for it, but it's a really concerted effort for us to follow our so the Human Capital Project is really trying to get countries to invest their own money, but we're also stepping up to help them. Now, and what is important about that 74% is for the first time we've seen the bank's share of financing going to human development increasing. So for years, the share of financing to human development's been about 16%, and it's gone up this year to 25%. So, so my goal is to actually get it up even higher. That's something you can watch us and see how that goes, but I think that's a really important part of our commitment to actually ensure that countries place more priority on these investments.
No, that's really encouraging news, and realizing in some ways that countries will use every dollar they get for IDA, it's really powerful to be seeing an increased proportion of that, again, going into human capital, and we are committed to being your partners on that and encouraging it from all sides.
Can I say something
please.
about something you can help with on the financing side? One thing that always worries us is when a country goes from being an IDA country and graduates to being a middle-income country, sometimes when their financing becomes more expensive, and sometimes they stop actually asking us to help them with human development investments because of the terms of the financing. And we think that that's actually a very short-term decision that they take, because they should be looking at the total financing needs that they have and ensuring that they're financing all the investment needs they have, and they should be prioritizing human development within that. So we're actually trying to encourage countries to de-link the terms of individual loans to look at the basket of things that they need external financing help for, because they borrow from us not just for the financing, but for the technical help that they get in reforming and improving their services as well.
Yeah, and many of our partners in particular have been leading work around this issue of countries transitioning off this financing, because not only are they losing IDA, but many countries are transitioning off things like the Global Fund and the Gavi Vaccine Alliance, and and polio support. So many countries, as you're saying, are facing a kind of multiple transitions. And so, frankly, would love to look also at working more closely with you all in sort of helping with the civil society, kind of coordinate the work that you're doing, other institutions are doing, and civil society advocacy to make sure that countries aren't falling back on their investments, as you said, in human capital as they transition off the grant financing or the lowest lending, lowest cost lending.
Can I say a bit about the GFF?
Yeah, please, sure.
Didn't get to it. The GFF is a global financing facility for maternal, child, adolescent health. And this is really, I think, a really important instrument that we have for this group of countries that are really facing very challenging situation with things like still really have challenges like maternal mortality, infant mortality, and very high fertility rates. And these are countries that are really struggling to get started on the demographic dividend. We talk about countries that have developed traditionally are able to do so because they invest in health and nutrition, they invest in reproductive health, population rate, the fertility rate starts to come down, and the investments in health and education give them the boost. And this is really well documented in development. Many countries in Southeast Asia have followed this path and had tremendous success. There's a group of countries that we really worry about. There's about 30 or more countries in the world which still have fundamental issues with maternal mortality, too high infant mortality rates, and fertility rates well over, on average, over 4. If a country has a fertility rate over 4, it's really going to be struggling to get on this demographic pathway to development. And we have countries that are up to as many as 7 and are getting higher rather than going down. The GFF is also, I think, the thing about the GFF is it's pairing with World Bank financing to support countries to actually put in place comprehensive investments, and it also is a mechanism for making sure that countries are themselves investing in these basic services, which are going to be critical. So this fund is going through a replenishment this year. It's very challenging because there's a lot of replenishments going on at the same time, but we really think that this fund has been really important for getting governments supporting governments to actually put in place programs for these critical investments.
Yeah, no thanks on that. And many of us have been working on the global financing facility in our various countries to support that, and also to support the sort of central engagement of civil society at global, but especially at country level, because again, these are only going to work if in fact you've got all the partners in the country working together. Just a couple more areas I want to touch on, and then we'll open it up for questions from everybody in the room. But another piece, the bank is the largest external funder for social protection programs. And so we'd love to talk for a minute about your thinking on that, and particularly, again, many of us have been working on some of the opportunities of social protection programs to become even more economic inclusion programs, and particularly some of the ultra poverty work that was pioneered by BRAC of kind of layering a set of services on broad social protection programs to really address the needs even of the very poorest people living on like literally 30 or 60 cents a day, the ultra poor. So just, and very excited about the new platform for economic inclusion in the bank that is actually focused on that and sort of sits under the jobs and social protection area within your vice presidency. So just your broader thoughts about sort of social protection and particularly leveraging more economic and social inclusion.
Yeah, I mean, I think social protection has many critical roles. Obviously, the first thing is, as you talked about, for the ultra poor, it is often the only safety net that they have, and it can be, I think, obviously it's really important in its own right for reducing the level of hardship that the most poor have in many developing countries. It's also a critical sort of mechanism for protecting the poor from shocks. And we know, for example, that in many developing countries, an illness in the family can actually make a poor family even much poorer, for example. And these social protection mechanisms are really important for reducing the hardship that people have, but also making the poor a bit more resilient than they are. The other thing I think that's really important about them is that they are actually a really important part of the overall human development outcomes, because they are actually helping poor families keep kids in school, poor families accessing health services, and even more so, actually, in some cases, are encouraging families to actually access human development services in ways that they wouldn't otherwise be able to. I've seen this in many countries where I've worked up close. I've seen the importance of these programs, but what we're doing, I think, is as we help countries to design these systems, we're actually even thinking in sort of broader ways of how we can actually help. So, for example, I can think of one country where we were financing grants to people who were internally displaced by conflict returning to their homes and needed to re-establish. In some cases, they needed to rebuild their homes, and they needed to get their livelihoods, their agriculture activities up and running. And we were talking about these families and just how vulnerable they are, and so we actually made sure that everybody who got a grant also got a World Child visit. And from that, many children who had very important disabilities or health issues were identified, and the community health workers were able to support these families. So, you know, when you design these schemes, to think about, you can actually play a really important role in helping these other human development outcomes to be achieved as well. Now, I think one thing that is really important at the moment, and it's, I think, part of the sort of whole discussion about scaling up financing, is the urgency of scaling up these schemes and actually getting more coverage, because there's still millions of poor people who don't have access to any safety net at all, and we know that these schemes are having tremendous benefits. The other thing about them is that they have to be designed in different ways for the rural poor and the urban poor. And I think we have a lot more experience of the different design options that you have for these schemes. I was in Ethiopia just a couple of weeks ago, and they've for a long time been investing quite substantially in social safety nets for the rural poor, and a few years ago they extended it to the urban poor, and I could see up close just how profoundly important these schemes are. The other thing about them is that they're giving access to financial inclusion, they're giving access to work opportunities in some cases where it's associated with community work schemes and so on, and so these are actually really having other longer term economic benefits as well.
Yeah, and I would say, when we talked earlier, I know you mentioned also your kind of long experience coming from the South Asia region with BRAC and with other partners, you know, in Bangladesh and elsewhere. So look forward to working with you about supporting these broader social protection programs, and also some of the exciting kind of comprehensive ultra-poverty strategies that can be layered on top of that, and I think for huge impact. Looking at time, I think I'm going to turn to the audience for questions, but you have to promise me one of the questions I do want to talk about is particularly the UN high-level meeting upcoming on tuberculosis and what we can do on that, because Annette Dixon actually has a sort of long history on that. So I'll let one of you all, I know there's a question out there on TB among others, but let's see, maybe let's take maybe 3-4 questions, and then we'll take a second round. So sorry, that's 1, 2, 3, 4, and then we'll come to another round.
Sorry. Hello, morning. Yeah. My question won't be on the HLM, so I'll reserve that for someone else. I actually just wanted to revisit the gender component of the Human Capital Index. You know, as we know, gender inequality, gender discrimination is one of the key equitable barriers that prevent women and their children from accessing nutrition, health, education, even participating in the labor market equally, and it hinders their children's ability to develop fully in their first 1,000 days, and just broadly breaks cycles of poverty. As we see more IDA donors centralizing gender equality and gender transformation in their international assistance frameworks, how do you think, or how do you feel the Human Capital Index can be utilized to tackle those gender discriminatory barriers in countries, as well as incentivize countries to basically revisit these systemic disparities and tackle them kind of systemically as they do hinder progress towards building human capital?
Great. Let's do 3 or 4 questions. Yeah.
Good morning. Thank you very, very much for being here today. My name is Jean-Francois Tardif. I'm from Canada, and like many people in this room, I advocate to give people living in ultra-poverty a fighting chance for life with dignity. And as you know, the ultra-poor, those that part of the extreme poor that suffer multiple deprivations in health, education, living conditions, etc., they are the least likely to be reached by even the well-meaning, well-designed programs of governments and NGOs. So here's really a two-part question. How can the bank target its operations so it makes sure it actually reaches, it doesn't miss the ultra poor? And how can it verify, once the programs are being implemented by its monitoring, that indeed it's reaching the ultra poor and it's reaching them with success? So that's the first part. And the second part goes to something that you alluded just a few minutes ago. And in the area of social protection, how can programs be leveraged to really dedicate a portion of the funds specifically to a graduation approach that would accompany the ultra poor on their way out to poverty?
Great,
Thank you very much.
Great. I think we had one more, this one back here, and then why don't you hand that mic? We'll go there and then there. Go ahead, Sochi. Yeah.
Hello, my name is Bon Mai. I am a global youth leader for nutrition, and I represent Cambodia. So first of all, I would like to show my appreciation on your cooperations, your wonderful cooperations, and President Jim Kim leaderships on and his commitments on October 2016 on nutrition for in the early years initiative, and he actually reached that commitment. So my question is, how do we as youth advocates do to help facilitating your wonderful commitments, your future commitments? Yes.
Thank you. Thanks. And one more and then we'll...
Hi, I'm Grace Mo. I come from Tanzania. I have one question specific on GFF. In fact, the GFF has been very helpful in investing around RMNCH in the country, and seemingly there could be good indicators coming out of this. What is the future of the GFF, and what is the role of the CSOs around it? Thank you.
Thank you very much. And just a couple of notes for some folks that don't know some of those abbreviations. RMNCH, Reproductive, Maternal, Newborn, and Child Health, and civil society, the role of civil society organizations with the Global Financing Facility. Great question. Thank you. So maybe just plenty of stuff there.
Okay. Firstly, on gender and the Human Capital Index, all the indicators that are embedded in the index will be gender disaggregated. And so you will be able to look at each indicator as well as the composite index to look at the different rates, if you like, that bring out the aggregate number. Now, I actually think that underpinning a country's result on the Human Capital Index are really many important issues around equality and inequality, gender being a major one. But there are also other kinds of inequalities that won't be necessarily apparent in the first round of the index. And it will be important, I think, at the country level to do more inquiry. So, for example, geographical differences, areas where the index results are very different, ethnic, tribal issues which underpin inequality and so on are really important, as well as gender is an enormously important one. And so I think in the later rounds of the index, we will try and get more granular as we go, but we don't have data across all countries on these things. So some of these things have to be investigated at the country level, and I think it's really important to encourage policymakers to do further work which actually looks at why countries are not doing so well. The other thing that's really important is to look backwards and to see which countries are improving and which countries are actually deteriorating on different aspects of the index. And when we do that, we can see that countries have got, say, for example, education outcomes. Dr. Kim talked about one aspect of the Human Capital Index will be looking at learning adjusted years of education. And we can see some countries are actually deteriorating rather than improving. Same on stunting, we know. Some countries are going in the wrong direction. So these are all really important things that need to be done at the country level. On targeting the ultra poor, I think this is where the design of social protection systems is really critical. And here I think common sense would tell you that you need to bring together what data we have from surveys and information that we can source, and also local knowledge. Because in many communities, in very poor communities, people know who the ultra poor are, and often the neighbours and the people living in the same village are actually playing a critical role in actually helping these people. So the design of systems needs to actually bring these things together. If I can make a plea, is the importance of household surveys actually for targeting is really, really important, and especially in countries where there's a lot of displacement, because we find we have, if we're working in a country where they don't have a census even, don't have up-to-date household surveys, and there's been displacement because of conflict, it's very hard to actually use the available information to find the ultra poor. I've come from working in South Asia. If you take a country like Afghanistan, just how much displacement there is because of the conflict, people coming from rural areas to urban areas, people coming back from countries in the neighboring areas, just a huge amount of displaced, and so it's actually a big challenge to actually identify the ultra poor. In some cases, the graduation approach can work, where you can see that people can be lifted out. In some cases, due to disability and illness and so on, there's actually some people who will continue to need long-term support. I was visiting the urban program in Urban Social Safety Nets program in Ethiopia a couple of weeks ago, and met the community of women who are actually benefiting from the scheme. And then they took me to meet one of their neighbours, who's a woman who was severely disabled with mental illness and had 2 young children, a 3-year-old and a 5-year-old. And the social safety, she was completely housebound, and the only support she had before the safety net scheme was her neighbours helping to feed her children. She was sort of basically totally reliant on the people around. And the safety net program for her is her only lifeline for these young children. So it's for some, it actually speaks to the need for countries to develop social security systems which actually cater for the needs of all of their population. On youth advocates, I think there's a lot here. One of the things that I think is really important for young people is to actually get informed about the issues. And in a way, this is an exciting time, because there's never been more information than there is available now. I mean, I think I was just telling before we met, every year we do a World Development Report on a very important topic that's important for development. This year's report, which will be released at our annual meetings, is on the future of work, and this is where the index is going to be released with it. Every Friday, this time, we normally release the report when it's finished. This time, as it's been written, it's been uploaded every Friday afternoon. So the drafts for each week, as they're evolving, so you can actually take a look at it anytime you want and actually see what it's saying at the moment, and you can send in comments. So it's actually available in real time as it's being written. So it's a bold experiment, but it's kind of interesting. So I actually think, I think for youth advocates, one of the things is actually to focus on, what will be important for you as you actually are going through your journey, if you like. How well are you being served by the quality of the education that you're receiving in your country? We know that there's a lot of countries where not only are the teachers not trained, in some cases they're not even showing up to work, and if the teacher's not showing up, kids don't show up. Some of the things that we're financing in some countries is trying to actually improve the attendance of teachers and improve the training of teachers on the job. And so these are the things where feedback from young people who are actually students in these systems is really important to help the design of these interventions. On the GFF, I think that the GFF has been a fund that's actually only been in place for a couple of years. And I think it's really important that we actually scale it up, because it's actually only been reaching a small number of countries. We want to actually significantly expand it and also improve its operation in the countries where it's operating, and really help to ensure that these sort of foundation services which are critical for investing in the health of the mothers and the young children, are really actually reaching all of the poor in these countries, because these investments are actually going to make the difference in the life chances of these children. So we really want to scale it up, and I think the more you can do to help ensure that the partners who are supporting the GFF are actually aware of how important it is for getting the results in your particular countries.
We have time for maybe two more questions. I can't see Beth and gentleman in front, and then so maybe I think those are probably going to be the last two. Sorry.
Thank you very much. I would like to ask Joanne's question about the UN High-Level Meeting for TB and its relationship to the World Bank and the interplay on that issue between the World Bank and the UN High-Level Meeting, and would like to know also what we as U.S. advocates should be doing in regard to our own national engagement there on that, and the participation of our national leaders there, as well as other leaders around the world. Thank you.
My name is George Budagu Makoko, and I'm originally from DRC Congo, but I right now live in Maine, Portland, Maine. But I want to ask you, you talked about the poorest people, the programs that are designed for them, but I want to ask you, how about the refugees, the children who are in refugee camps? Is there any specific program that you have for them? Because they are not, I don't know if there will be a program for the country they're into that will be helping them, or they are just helped by another agency that has some program, because that's where we found the poorest kids and who are dying with all other things that we're talking about.
Okay, on TB, I think there's a bunch of issues which are really important in coming together. The first is obviously in making sure that foundation health services work. And that's about making sure that there are actually universal access to health care, and that it's of a good quality. And the reason I say this is because we've started surveying, we have these service delivery indicators, which is a survey that we do looking at the quality of health, the quality and availability of health and education services. You can look at this on the World Bank website, but there's about 7 countries that we've surveyed looking at the quality of health care, all in Africa, and half of the people presenting for the most common conditions were misdiagnosed. And for countries with very high prevalence of TB, that means that people are not being diagnosed and they're not being treated correctly. And so actually getting foundation health services working for the poorest, because we know TB is a disease of poverty, basically, is like the first sort of step. The second thing that's really important is that there are middle income countries that still have really high levels of TB. And two countries that we always quote are India and Indonesia. And these are countries where the donors have said, well, you're rich enough to graduate to the next level, but they still actually are not able to manage to control their outbreaks of TB or their epidemics. I'm not sure technically what the right word is. And so it's really important that these countries continue to invest in healthcare, because we know with TB that treatment is prevention. You know, because it's an infectious disease, you essentially need to treat. And in some cases now, in some countries, we have actually very high levels of drug-resistant TB, and that goes back to this issue of whether people are getting the right treatment and are continuing to access treatment, because we know we get drug resistance when treatment is interrupted or the wrong treatments are being given. And so it's really, to me, it's sort of about making sure that we do the basics right in getting health systems working. And I think also understanding, and I think here the donors are really keen to focus their aid on groups of countries that they want to target. And that's important, but not to forget that the middle-income countries still have very high levels of TB and, frankly, stunting. And, you know, in both the case of India and Indonesia, it's not only TB, they also have still have very high levels of stunting. And so these are countries we're actually making sure that they are actually giving priority to these things themselves, and the international community is partnering with them to help design interventions. Often the challenge in these middle-income countries is, you know, you have to step back and look at, okay, so they're investing money, they have health systems, but they're not getting good results. What's stopping that happening? In some cases it's capacity challenges, in some cases it's governance challenges, getting health workers to continue to attend and so on. So really important. On refugees, actually one thing that has changed is that IDA, the Fund for the Poorest Countries, now as part of our increase in funding available, we have a special window available for IDA countries that are hosting refugees. So if a country is in a situation where it's hosting refugees and it's an IDA country, we give them additional money. And this is really important for countries like Cameroon, for example, or a country I know well from South Asia, Bangladesh, which has this very, very large number of people who've come from Rakhine State in Myanmar, the Rohingya people. These are the countries that are able to access additional grant funding. In the case of Bangladesh, the fund was going to be available on credit terms, and the Canadian government stepped in and brought the interest rate down to make it a grant terms. So that's a great story about advocacy. It's a great story where developed countries can partner with IDA to actually help refugees. Most refugees in the world are hosted in very poor countries. And this is little known, because I think we kind of, in the global media, there's so much attention to refugees in developed countries that we actually forget this. Working in South Asia, I was, you know, enormously aware that Pakistan is a country that's probably hosted the largest number of refugees ever, because for decades they've hosted huge millions of Afghans. And very rarely actually acknowledged for the importance of that role that they've played. And so I think it's really important that we actually extend help to developing countries that are actually opening their borders and providing a safe haven for people, and that we help them to ensure that they not only are able to care for the refugees, but their own host communities are also are protected in that as well. I went to visit Cox's Bazar in Bangladesh, where the Rohingya are hosted, and it was actually heartwarming to me just to see how the Bangladesh population, including BRAC, who's here from BRAC? doing a phenomenal job of actually caring for these people. The Bangladesh government, their health department ministry, was able to immunize 500,000 people in 3 months.
Wow. Wow.
Just that alone. I mean, more children are actually getting some education in the camp than what they were getting in Rakhine. It's, you know, and it's a horrendous situation in the camp because it's the most crowded, densely populated. I mean, there's something like 20 or 30,000 babies going to be born in that camp this year. It's a phenomenal effort. And, you know, I visited a local kind of small hospital, and the head doctor, the director of the hospital, said he actually described the refugees as our honoured guests. They have Bangladesh patients giving up their beds because the refugees are sicker than the Bangladesh patients. Really touching.
Yeah. Thank you for that perspective. I think we could go on for a lot longer, but we actually need to close this session. So I want to say just a couple of things. One is back to your question, Beth, and mine. You know, on the high-level meeting for TB, it is a particular opportunity that the bank, and you in particular, even in your previous roles, have played a key role on some of those issues. For instance, earlier in Russia and Eastern Europe and Central Asia. We look forward to continuing to work with you and with President Kim to just see the particular role the bank can play on this, and just given the leverage that you have with countries. And then just more broadly, I think this IDA replenishment and the scale of it and how it's being used linked to the Human Capital Project is just an enormous opportunity. And this Human Capital Index, which is meant to illustrate where it's working and where it's not, and sort of hold countries to account for what they're doing, I think is a huge opportunity for folks in countries, but also for us to think about globally how we can help leverage that in terms of encouraging countries to make these investments. So look forward to continuing to work with you on that, and supporting both the bank's own investment and the world's investment in these things. And thanks so much for being with us here today, and really glad to have you.